Dr. Edilson, thank you so much for accepting the invite and welcome to the show. I want to say how grateful I am for you to be here with us today.
My pleasure.
Doctor, for those who don't know you, can you please just tell us who is Dr. Edilson and what do you do and why do you do what you do?
Well, I'm orthopedic surgeon. I have a specialization in pediatric, so pediatric orthopedic surgeon. And I decided to be an orthopedic surgeon since I was before I started the medical school. I was a volleyball player, so we have a lot of contact with sports and, of course, trauma, physical injuries. How about physical in general? So I think it came from there. And so I decided since at the beginning of the medical school, I never changed. I always want to be an orthopedic surgeon.
Wonderful. Doctor, for those who don't know, what is, let's say, an orthopedic surgeon? What do you do basically?
Well, orthopedics is divide basically in trauma. We do all the trauma, for example, upper and lower extremities trauma, like fractures, muscle lesions, joint lesions, and also all the affects our body as especially in the bones and the limbs and the spine that affect the musculoskeletal. That is the area of orthopedics. So we quite now we have, because it's so wide spectrum, now is divided. Most of you know that we have a knee surgeon or shoulder surgeon or spine surgeon because what happens that development of any specialty, this specialty become very broad. It's difficult to be keep up with all the techniques and the treatments and that come out in all knowledge of each area. So now we have this is what you call super specialities. Yeah.
Super specialities. Doctor, what are, like, let's say, most of the common problems that you face with your clients? Like, what's something that, let's say, an injury that is very common in our society over here, and why does it happen, in your opinion?
Yeah. Well, in general, in orthopedics, you have knee injuries, quite common because the football, these sports that use the lower extremity, rugby, most of these sports. So knee injury is prevalent in our society, and also some not here in Dubai because Dubai is a quite different. We don't have elderly the population is younger than most of countries. So because in most countries now we have like a total joints, so they have osteoarthritis, and the joints, of course, they our joints are very well built, but they may not last like forever. So some you have to change the joints. You have the prosthesis in that population. But here in Dubai specifically, we still have a lot of trauma, shoulder problems. For example, if you are a tennis player or basketball player that use volleyball player use a lot of your shoulder. Shoulder also is prevalent lesion. In my area, because I do pediatrics, so we still have a lot of trauma, especially here. Trampoline is monkey bars, and for the teenagers, scooter. These words I listen a lot in my clinic, and also problems and development like lower limbs alignment, problems of foot like flat feet or some usually scoliosis, also another spine problems. So it's quite a lot of wide range of problems.
Doctor, how can, let's say, the flat foot affect the overall alignment of of the body? Because I usually hear that the foot is very
Mhm.
essential in the alignment of the overall body. So can you please give us an idea of what is a flat foot first, and what problems can arise from it?
Well, flat foot is talking about the shape of the foot. Usually, you have a longitudinal arch. If you see the foot internally, there is an arch there. And some people has low arch or
Hmm.
there is no arch. It has full contact on the floor.
Hmm.
So most of them is quite normal in kids, for example, 2, 3 years old. Most of the kids there are some degree of flat feet.
Hmm.
And when they develop up to the age of 8, 10 years, they develop the arch. But some of them and some adults still have flat foot. There is some studies that shows that almost 15% of the population has some degree of flat feet. I would tell you that most of these, like me, my son, we can live with that without problems. We don't need
Hmm.
treatment. Sometimes it's just the shape of the foot, but does not have a relationship of other problems. In the
Hmm.
past, there is a belief that the foot could have problems in the spine with back pain, but studies done in more scientific way, they did not show there is a relationship. So most of the flat feet, as I tell the parents, if the degree is not pronounced, is not causing symptoms,
Hmm.
even if it reach like this age, he doesn't need any special treatment.
I see. Now, when does it, let's say, the flat foot becomes a problem? Like,
Mm.
at which degree you, as a doctor, determine that, okay, now it's a problem and we have to fix it? And if so,
Um,
do you have,
mm.
let's say, measurements to fix it without surgery? I mean, is it fixable without surgery, like by lifestyle?
Um, well, there are some ages that, for example, if you reach 8, 10 years and still have flat feet and have symptoms, or has been progressive, it means that getting worse over time, and there is indication for treatment. I have to discuss with parents because we don't have a lot of good conservative treatment, something
Mm-hmm.
that is very effective. The use of shoes, insoles, or some exercise, um, they did not show um, real results and change
Mm-hmm.
the natural history. So most of the time, if you have a child that reached like 8, 10 years old and present with symptomatic, has pain, has some difficulty, and sometimes you treat, then conservative uses some insoles or shoes in a way that more for treated the symptoms. Not, I tell always the parents, maybe not change the shape of the foot, but
Mm-hmm.
the child can have a normal life. If with conservative treatment, with insoles, shoes, some exercise, it does not improve, then you have to go for a surgery. And you have like options, types of surgery that really changes the shape of the foot. But this has to be very well first evaluated to see if the need for the procedure, because always procedures, there is some risk on the procedure. There are risks on procedures, complications.
Mm-hmm.
So you have a weight of this with the results that you want to provide for the patient.
I see. Okay, now let's dive into a little bit more details. You mentioned that you're have a specialty in pediatric orthopedic surgeon. Now, what are the problems that, for example, you face with kids, let's say? Problems that are, let's say, out of environmental factors, like that out of nature, via genetically, let's say. What are most of the common problems that they come, and how do you usually, like, for example, address them?
Well, there are always genetics every year, we find out new genetic factors that
Mm-hmm.
in the past, some diseases would say idiopathic because you don't have any cause for that. And now you have identified genes and conditions that cause some diseases. So, and this is very interesting because this is the first step for some treatment. And
Mm-hmm.
today you have genetic treatment for many conditions. So always there is some genetics. I always tell the parents that the apple doesn't fall far from the tree. So always we have. I always ask when I see a patient about family history
Uh-huh.
to see because sometimes you have already the history in the family, and we can then also draw what may happen with that patient. Okay. Um, I would say that there are some cases that's quite strong that genetics, for example, DDH, dysplasia of the hip. We know that if there are cases in the family, especially the mother and the sisters, because it's
Mm-hmm.
more girls than boys, there is increased chance of the child to have DDH. And
Mm-hmm.
that way we proceed with screening. We check the hip um, mandatory to
Mm-hmm.
rule out any condition that can be genetics. But of course, there are some like legs position. One thing that is a very often consultation reason is that bowing legs. Sometimes you have the family that. Sometimes they go there and said somebody in the family and the father, may I have? So I check the parents, and sometimes they are surprised because I have the same. They
Mm-hmm.
didn't, and I'll ask him, do you have any problem? Because sometimes it's just a cosmetic, it's not function. So
I see.
that's importance that genetics on everything.
I see. That's interesting, actually. Now, let's say you have a kid who came. Like, what's your assessment process, for example? How would you assess a situation, and at which point would you decide that okay, now it's a point where we have to do a surgery? Like, at which point in the problem you determine that now we have to take like a drastic measure and go for the surgery solution?
Well, always we start with a history. That is the fundamental of the diagnosis. So the history is the most important. We ask for the if it's getting worse, if it's getting better, when they saw what this impact in the child or the patient's life, and about, as I said, the how the pregnancy, how I was born, because some conditions can be came from the pregnancy or even the delivery. Then the development, how is what age you start to walk, for example. We know that
Uh-huh.
we start to walk about 1 year. Up to
Mhm.
1 year's 5 months is normal. So these details is quite important. Family history, as we mentioned before, and then you proceed with the physical exam.
Uh-huh.
So you have to analyze, and that's interesting because sometimes you see, because let's see one example, scoliosis, that is a
Mm-hmm.
spine deformity. We know that is prevalent in girls. So sometimes I have received like a teenager, and usually start at 9 years old, 10 years old. So I receive a teenager, 12 years old, with foot pain. So I check the foot, I've seen history, I ask it if there is a scoliosis in the family, problem, orthopedic problems, and then I check the spine. And sometimes we have the diagnosis of scoliosis then, because scoliosis, for example, deformity of the spine, they don't have pain. It's just
Mm-hmm.
it starts as a cosmetic, just a deformity. So because that is the importance of you have this time for history and exam. When I order some uh, X-ray, for example, before I order, I always I tell my residents, you have to have an idea what the patient has.
Mm-hmm.
So the X-ray is to confirm. confirm or to rule out some conditions. But we think, well, this patient probably has some conditions or have a number of conditions that I know. So that is very important because when you do exams just because we should ask some exam, uh, it came some results that you didn't expect, then you can have problems for the to deal with the patient, the diagnosis. So most of the treatments that you try are conservative treatments. Surgery is the last resource. Of course, there are conditions that is the mandatory to do surgery. For example, open fracture.
Mm-hmm.
The treatment is not conservative as surgery. So
Mm-hmm.
there are some conditions, but most of the conditions that you see in clinic, um, we try always to have a conservative treatment first.
I
And
see.
because we should treat the patient, not the diagnosis. So sometimes the patient has one diagnosis. For one patient, the surgery is a good option. For the other, is not a good option. So you have to think about that um, when you tell the family that needs some procedure.
I see. Thank you for very much, doctor, for this. Can you please tell us what's the difference between scoliosis and kyphosis for those who don't know, please?
Scoliosis is when you have a lateral deformity. And
Uh-huh.
so the spine, if you see frontal, the spine is straight.
Mm-hmm.
So there is a S, scoliosis is like S shape of the
Uh-huh.
spine for the sides. And you
Okay.
have normally, if you see the person lateral from the lateral
Mm-hmm.
side, you see two curves. One is a thoracic kyphosis and
Uh-huh.
a lumbar lordosis. And so in the front, the spine is straight, but if you see by the side, is a S. So there is a
Uh-huh.
kyphosis, a lordosis. Of course, there are some degrees of normality. And
Uh-huh.
sometimes you have what we call hyperkyphosis, that if you have more than 45 degrees, we measure in the X-ray, and then
Uh-huh.
we say that the patient has hyperkyphosis. So it's like a hunch. That is that. So
In the
that
back.
is, I always
Yeah.
do this diagnosis, but basically you do this clinically. Most of the patients
Mm-hmm.
don't need an X-ray. For this
Mm-hmm.
scoliosis, we have what to call forward bending test or Adams test. So we saw the patient from behind. We should see the shoulders, the outline of lumbar spine, and ask the patient to touch the floor without bending the knees. So if there is scoliosis, you see also one side more elevated than the other side, asymmetry.
Mm-hmm.
This is because in scoliosis, there is a deviation and rotation. So it's easier to
Uh-huh.
see in that position. And this is what we call 1 minute test. And they have done that for screening in schools. The doctors go, or the doctors, physiotherapists, or nurses, they are trained. So they go to schools and they saw all the kids in the school
Mm-hmm.
to rule out scoliosis because, as I said, there is no symptoms. The patient has no pain, and it's very important to see to have it diagnosed before deformity become more major deformity that may require procedure.
That's interesting. Doctor, I'm assuming that you see a lot of kids. Let's say because your specialty is in pediatrics. So, do you face any challenges in the kids? Let's say pinpointing the symptoms, because I'm assuming that it's difficult for them to pinpoint the symptoms or the pain or what are they facing. So, how can you solve that, for example, as a doctor?
Mhm. Exactly, because the kids, the information sometimes you get from the parents, and the
Uh,
kids, I think, they have a difficulty to verbalize. They don't want sometimes any contact with the doctors. Some kids are a little bit afraid of doctors. So that is the challenge for us. For example, I gave you one situation is a challenge. Uh, Limping. the parents
Hmm.
notice that the child started to limp one side. Limping means that one side is they walk asymmetrical, one side is different than the other. So then we ask, is there any trauma, fever? Sometimes they don't know anything. The child doesn't say anything because it's 2, 3 years old. So that is sometimes a challenge. Most of the time,
Mm.
we deal with, I have done, I'm pediatric orthopedics for 25 years. So um, we, I would say that I should I have to know how to deal with those situations, of course, because I'm there for that. And but always is difficult. Sometimes you have to observe. Right? Some patients, I say, we don't have diagnosis yet. Probably is just a trauma. Most of the kids that are limping,
Hmm.
they have a lot of trauma. They are prone to trauma, or uh, I always tell that first rule out the serious condition that needs to be done something very fast. So rule out that. Sometimes you can observe the patient. Doesn't need to have a diagnosis in the first visit. You just observe. And sometimes it goes away. They're limping. If, for example, if it got worse, you have to check. So these are some situations that we learn like in the day by day. Is very typical of pediatrics because of the difficulty of patient verbalize symptoms.
Hmm. I see. Doctor, have you practiced your specialty in Brazil, or was it here immediately?
And I did most of my time in pediatrics orthopedics in Brazil. I worked 25 years at Children's Hospital in my city. That
Mhm.
is the largest children's hospital in South America. In Latin
I
America,
see.
it's 400 beds. I used to see 50 patients in one afternoon.
Oh,
But of
oh.
course, we had residents, fellows, but quite a busy hospital and the big number of patients, especially when you have countries that you have a governmental insurance.
Hmm.
In Brazil, 70% of the population they go for governmental insurance. So, and you know that the hospitals that's quite busy in general. There is sometimes
Hmm.
long queue for consultation for treatment. Have to wait in time for,
Hmm.
but it's a quite interesting experience because the you really see a lot of problems, serious condition that requires more specialized treatment. And I also did my fellowship in US and also in hospitals that are also quite busy, specialized in that field.
Now, this is where comes my next question, doctor. Like, have you noticed, let's say, any certain problems that are due to the environment? In other words, like the problems which you were facing with the kids in Brazil from diagnosis and pinpointing what the problem is, are these similar to the problems which the kids here in the UAE are going through, or are they different due to the lifestyle and the environment?
Uh, I would say that is a quite difficult question because I don't have any study comparing. Here in Dubai, you have a situation that 90% of population expat. So we have like
Mhm.
this mix of cultures and countries and the way they see a little bit different. Of course, when I have most of the situations in orthopedics, they are the same. Like let's see, a flat feet or a hip dislocation in Brazil, in US, here in Dubai, in any country. The problem, basically, the treatment is very well is the same. Uh,
Mhm.
but of course, the way that we have to talk with the patients, everything, there is some difference, and the way that they see the patient and the parents see the treatment also changes a little bit. About the
Mhm.
problems, Um, Not very much. I think that in Brazil, my experience was because it was a reference center. So the patients to
Hmm.
reach the doctors, like this happened in other systems as well. They have first go for a general doctor, family medicine doctor, and then they refer to you. So then, or here in Dubai, most of the patients directly go to you. So the family
Hmm.
just book with pediatric orthopedic surgeon because I think that is this. So then you have more simple cases. When you
Hmm.
have a referral, has to pass through family medicine doctor or pediatrician, then you have more problems. Um,
Hmm.
Major, I would say more um, specialized cases, the proportion increases of that. So that is, I think, that is the main difference. Also, some, of course, some problems here. I don't see that the difference in Brazil. Maybe because I have this bias in Brazil that I treat so more complicated cases, basically. Yeah.
Okay,
So
I see. Doctor, what, let's say, for example, me as a parent, for example, or for all the parents out there, what can they do to care for the musculoskeletal health of their children? Like, what are the basics that as parents, let's say, they have to follow to do their part in caring for their kids?
I think I think prevention for trauma is important. I participate in programs in Brazil for education in car transportation. That's the problem here in Dubai. I think most of the kids are not properly sit in the car. We know that kids need to
Mm-hmm.
have a seat, not go free in the car. There are very well established, like in first year of life, they need a baby bed, a baby seat,
Uh-huh.
and then after this age until like 7 years they need a chair. After this age until like
Mm-hmm.
4 or 5 they need a chair, and then he needs a buster, that is that elevation,
Uh-huh.
to use properly the seat belt. So that is quite important because a study shows that the mortality and uh, major lesions are like 70% less if you use
Mm-hmm.
proper transportation. Okay.
Uh-huh.
Also, one thing that one accident very common even here is trampoline. Kids in trampoline, they
Uh-huh.
leave it, they leave the child in trampoline, sometimes more than one child, and then you can have like fractures, very common fractures. So it requires protection. Kids require surveillance. Like you have to check what he's doing, and some adult has to prevent kids because, especially any age, they, for example, 2 3 years, they don't have idea about um, risk, so they
Uh-huh.
climb, they, because they don't have an idea that they can fall and get hurt. So that is the parents obligation in this case.
I see. Doctor, something crossed my mind now. Like, is there any limitations to an orthopedic pediatric surgeon? For example, are there any cases where you had to collaborate with other doctors to find a solution for a certain case? Is there any collaboration between you or any, let's say, other doctors to solve some cases?
Very common that, because I gave you an example. I had just have a patient that came because had a foot infection.
Hmm.
So has a suspect osteomyelitis infection in the bones, and we need provided the initial treatment is antibiotics, so medication. And we have in our hospital, for example, have a doctor that is specialized in infection, in treatment of
Hmm.
infection. She does not. only osteomyelitis, but everything, all kinds of infection. And so I asked her, so what is the best? We have to have a plan. What is the best medicine for this kid? Because consider the age, the probable bacteria that he has. So that was, and they follow the patient together. So that's quite
Mhm.
important because then you have a much better assistance for the patient treatment. So this happens very often in our area because I know about bone infection, know about bone problems, joint problems, but if sometimes you need to treat the entire patient, so
Yes,
and you need the collaboration or assistance of other doctor.
I see. That's very nice. Doctor, what's the future for this specialty? Like, what, for example, what do you envision the future of pediatric orthopedic in terms of research and technology and patient care? Like, where are we missing? Like, what are the, let's say, information that we are missing currently in this field? And what more research should we do, for example, to have more answers?
I think that I see that in the future we have a lot of diseases. With diagnosis and treatment genetics. So even
Mm,
today, some problems that we need operation today, I think in the future they could be treated as preventive and correct some genetic defected patients. Not so easy because sometimes, even if you have the treatment, like now you have this for spinal muscle atrophy, you have a medication for that. Very expensive, by the way, $1 million
mhm.
each one injection.
Whoa.
But um, the yeah, help the patient from that medication on. So what happened in the past, if you had some weakness, will not recover that. So still need a treatment, still need the orthopedic treatment to these patients and general treatment. But I think genetics will be much more important. Um, new techniques, I don't think that will change that much now. Of course, you have new
Mhm.
materials that came, but most of the treatment that you have done today, the principle is the same. And also, trauma is something that will not change. We always tell the
Yeah.
residents and medical students, I say that, well, orthopedics, one thing is that accidents, fractures will still happen in the
Yeah.
future. So, um, and also because the population get older, if the population get older, more health problems. So this
Mm.
become a challenge today because, for example, if you live like 90 years, 100 years, your joints may not uh, be well at that time. So
As ready, let's
yeah,
say.
so the
Yeah.
number of need for arthroplasty, changes of the joint, total joints, is increasing around the world.
Mhm.
And also other problems, fractures, adult fractures, also will increase over time. And this for treatment still fracture, still have to go there
Mm.
and align the fracture and fix the fracture. And this will not change it, I think, dramatically in the near future.
I see. Doctor, through your time, like through your lifetime in practicing this profession, has there been any, let's say, technological advancements since the past till nowadays, which made, let's say, a significant improvement on the practice? Like, because I'm assuming that back then, there were like different tools, different mechanisms to treat maybe some certain cases. So, has there been any development in this field?
Yeah, we have for example, fixation of fractures. We have much better condition that when I was a resident, for example. You have elastic nails that put very easily, not very easily, but um, you can align the fracture, the very effective, and the patient recovered earlier. So that
Mm-hmm.
is improvement. This kind of material for fixation of the bones also improved. New
Mm-hmm.
techniques, knowledge about the bone healing also improve it. So that is the main advance that we see today. And also the not only the material, but the protocols also improve it.
Mm-hmm.
Um, more studies so shows what the best treatment for the patient. So that is the importance of the scientific studies, because I don't have some disease. If I just go for my experience, maybe I don't have enough cases to have the to see what is the best for the patient, but combined with others, um, um, patients combined, my number will increase. Then I have a better idea. We can draw really what happened to the patient, what the difference in treatment, what is the best treatment that can be offered for the patient.
I see. Thank you very much, doctor, for that. Doctor, is there any final note that you would like to share with the audience from your experience in this field? Anything that you can advise, for example, for people to be able to take better care of themselves, of their children, and overall, let's say, musculoskeletal health?
Yes, I think that as we spoke about safe transportation of the child in the car, I think this is one, because this can change everything for the families. If it happen an accident, this a huge impact for the family. So worth to prevent. And I think that
Mm-hmm.
kids be involved in physical activities today become a challenge, because the internet, the iPads and games, everything. So uh, kids should practice at least 6 hours a week of sports. Doesn't
Mm.
mean that has to go to the special football academy, or but be involved, play in the park, do a really
Yeah.
physical activity, using the physical. That is quite important. Posture, improve the posture of the patients. I've seen that they stay on. Now we have this neck pain in adolescents, very common in my
Yes.
clinic, because of the position, the neck all the time in flexion. So I think that, so this is important for the parents also to check, and especially to prevent problems. So it's quite that I think the world has changed, and here Dubai, fortunately, you have more possibility to play outside. Um, but that's important that the family also participated. This is one thing that I tell the parents, that of course, if you stay at home, the kids stay at home as well. But so at the
Yes.
weekends, or when you have a free time, try to walk, go to the park. It doesn't need to go to a special gym. Just do this activity. That's very important also as example for the kids.
Yeah. Thank you very much. Dr. Edilson, thank you so much for your information today. Thank you so much for sharing your experience with us today. I very do much appreciate your time. I wish you nothing but happiness for you and your family, and all the best. Doctor, how can people reach you? Like, where do you
I
work?
work in Med Clinic Parkview.
Hmm.
I- I'm employee there almost all the time, so I'm in orthopedics there. So easy to find me.
Wonderful. Dr. Edilson, thank you so much, and have a wonderful rest of the
My
weekend.
pleasure. Thank you for having me.
Thank you so much.
Bye.
Bye bye.